We have Dr. James Andrews and David Jones from the Ochsner Andrews Sports Medicine here to talk about sports medicine and their partnership. So Dr. Andrews, tell us more about the partnership between Ochsner and the Andrews Institute.
Well, I've known about the Ochsner Health system my entire life. I was actually born over in Louisiana, and that was my real interest in being part of that relationship with their sports medicine program. And I wanted to see if I could help bring the level of sports medicine to all of the Ochsner systems, including the state of Mississippi. And that's why I'm here today for the state games.
Gotcha. So David, tell us why is it so important to engage with youth sports activities?
Yeah, youth sports has just really grown as it's just become a big thing. And so the more that we can provide health care for those kids as they're out there playing sports, the better.
Gotcha. So how can or how does sports medicine advocate for the safety of youth sports or youth while they're playing sports?
Well, our mission at Andrews, Ochsner Andrews, is to keep the kids out of the operating room and on the playing field. My passion since year 2000, when I first started recognizing the injury patterns that were happening, particularly in youth sports, was trying to figure out how to prevent them. So we're really looking forward to being able to medically, sports medicine-wise, supervise all of these games with thousands of kids in this whole state coming in for sports medicine coverage. So we're providing that coverage here at Ochsner Rush Hospital and all of its athletic trainers.
So what's something that y'all see a lot, David, at the Institute? You know, what are things that you are treating a lot as far as sports medicine goes?
Well, with any youth sports, you see a lot of ankle injuries or knee injuries. It kind of runs the gamut. That's why we're out there to try to recognize things on the front end and try to catch it before it gets to the operating room, as Dr. Andrews said.
Gotcha. So how can maybe athletes do some type of preventive work, or, you know, I guess, is there anything they can do to prevent these injuries or be on the lookout for these types of injuries? Prevention
is an awful hard thing to do.
Yeah.
I've been working on that for my entire career. But just simple things like get a pre-participation physical by a sports medicine specialist. Make sure you have athletic trainers at all the public and private high schools, at all the events. Make sure you have an emergency action plan. Then you can get into specific things like prevention of injuries in soccer. You know, female soccer is a sport that has the highest injury rate for anterior cruciate ligament ACL tears, and there are programs that you can do to teach these young athletes how to jump and land that actually prevent anterior cruciate ligament injuries that you can go through and have and teach them during the summer months, and you can dramatically lower the injuries that occur for that ligament that's so commonly torn in the knee.
Gotcha.
So there are all kinds of things that we try to do, and the two big things at this time of the year, of course, are heat stroke and concussions. It goes without saying that those are completely preventable if you follow the rules and you set up your emergency action plan in case you do have something that occurs with a concussion or with a heat stroke.
Welcome back from the break. We still have Dr. James Andrews and David Jones from Ochsner Andrews Sports Medicine. So Dr. Andrews, tell us about how you and Ochsner Health are, you know, kind of have this partnership with the state games.
Well, we have the relationship to provide all the sports medicine coverage, and we have some 22 athletic trainers in this local area that'll be assigned to each one of the events throughout the state games. We also have a central location here in case they're hurt that they'll be located to, and then back to Ochsner Rush Hospital, where our orthopedic surgeons who are working at that hospital will be able to take care of them. So the main thing is to be prepared, and we are prepared to take care. And we'll have injuries. Injuries are going to occur. We hope that we can keep the injuries at a low level. The athletic trainers for Ochsner's are really the glue that keeps the sports medicine team on track.
Gotcha.
And they're going to be real busy all over this area, covering all the games over the next so many weeks.
Gotcha. So, David, how is this this partnership going to positively, affect the young athletes in the community?
So the care of our young athletes is our #1 priority, and so with there will be one of us at all the local events, and so we can meet the injury when it happens, and then we have access to our physicians at the hospital, if that's what it requires.
Gotcha. Gotcha. So, how is Ochsner and the sports medicine team supporting and caring for athletes? Like, I know you said y'all could take them to the hospital, but is there anything that y'all are going to be doing? I know you talked about heat exhaustion and stuff like that, but is anything like that y'all going to be able to provide as far as care?
Yes, we have. Of course, we always have most of what we need there with us to take care of the things that happen. From the heat illnesses, we of course just keeping them cool and monitoring the athletes and the officials as well. To just being prepared.
Gotcha. What do you enjoy most about just being able to help young people or even older people in sports medicine?
Just keeping them healthy and keeping them on the field and enjoying their sport. Athletics and participation has so many benefits, and we haven't even talked about all the benefits, particularly for young kids. The main benefit for young kids is it promotes an education that they need, and it provides grit that they learn, and it keeps them off the street.
Gotcha.
So these kids that are participating in sports and youth sports, they make better grades in grammar school, junior high, and high school.
Gotcha.
Because they're involved in sports.